Have you recently had a child and now you're suffering from postpartum depression? What are the treatments that they're giving you? Are you on so many medications that you now cannot breastfeed because of risk to the baby? Well, there may be multiple physiologic causes of your postpartum depression that your GP will never check. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Postpartum depression can be caused physiologically by nutrient deficiencies and or organ dysfunction or hormone dysfunction. So today I want to talk about possible physiologic aberrancies that can contribute to postpartum depression. One is iron deficiency. If you have iron deficiency, iron is a necessary cofactor for the creation of every single neurotransmitter. So for you to feel good and not be depressed, you need iron so you can make serotonin and make dopamine and make the other neurotransmitters. So if you have an iron deficiency, which is quite common in pregnancy, then that could be a driver of your postpartum depression. Because an iron deficiency that shows up in the second trimester and is maintained throughout, that's a few months of deficiency that could affect your neurotransmitter levels and contribute to, exacerbate, or cause postpartum depression. So iron deficiency is one. Iron deficiency. A second potential nutrient relationship is omega-3 fatty acid deficiency. So fish oil deficiency or omega-3 fats. Fish oil is a great source of omega-3s. So most Americans are deficient in omega-3s. They have an omega-6 to omega-3 ratio that's 40 to 1. Healthy ratios are 4 to 1 or less. So if you go into a pregnancy deficient in omega-3 levels and you have the baby and you breastfeed, well, the baby is preferentially going to get any omega-3s that you have in your body that you can provide, because the omega-3s are key to the baby's nervous system development and growth. So it's going to leach whatever you have through your breast milk, make you more deficient, and that can drive postpartum depression. So an omega-3 deficiency can drive or be one of the causes of your postpartum depression. A third cause is a hormonal dysfunction or an organ dysfunction, and that can be related to the thyroid. Any sort of thyroid dysfunction can lead to postpartum depression, but specifically as it relates to pregnancy, up to 12% of pregnancies end in postpartum Hashimoto's disease or autoimmune thyroid disease. I believe that number is higher. I just think that practitioners don't look for it because the complaints are hair loss and fatigue and depression, and the common response is, well, you just had a baby, of course you're losing hair, of course you're tired, of course you're depressed. So we need to look and ensure that there isn't an autoimmune process or an immune attack on the thyroid that manifested postpartum as postpartum Hashimoto's. So that is Hashi's postpartum. So if you're a woman who's had a baby recently and you're struggling with postpartum depression and you don't want medications and the possible side effects for you and the child, then these are three areas that need to be investigated physiologically for sufficiency. You want to be sufficient in iron, you want to be sufficient in omega-3 levels, and you want to have optimal thyroid function. In order to assess those things, you need to work with a functional medicine practitioner that knows how to assess it and know how they all interrelate, and then knows how to safely address those things. At Functional Medicine Charlotte, we do that routinely. Please give us a call, and we'd love to help you and your child live a life at optimal.